So we are starting the cranial nerves. So we know there are 12 pair of cranial nerves present in our brain. 12 pairs of nerves. Origin कहाँ से होता है इनका? Origin from brainstem. Brainstem से इनका origin है और brainstem किससे मिलकर बनती है? It is formed by three things: midbrain, pons, and medulla. Then these are the three things which form the brainstem. So we know there are 12 pairs of cranial nerves. So we are discussing the nerves. So first nerve is olfactory nerve. First nerve is olfactory. Second is optic. Third is oculomotor. Fourth is trochlear. Fifth is trigeminal. Sixth is abducens. Seventh is facial. Eighth is vestibulocochlear. 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 Clear. Done. Vestibulocochlear. Ninth is glossopharyngeal. 10th is vagus, and 11th is accessory, and 12th is hypoglossal. Hypoglossal. So these are the 12 pair of nerves. In which some are sensory, some are motor, and some are mixed. So first we categorize the mixed nerves. Okay, we categorize mixed nerves. So this is mixed nerve. This fifth is mixed nerve. Facial is mixed nerve. Mixed nerve. Vagus is mixed. These are the mixed nerves. 5वीं, 7वीं, 10वीं. And glossopharyngeal is mixed nerve. Then these are the mixed nerve. Mixed nerves. 5th, 7th, 9th, and 10th. Done. After this, some are motor. So one, this, and this. These are motor. Even these two are also motor. This is motor. This is motor. These three are motor, and last two are motor. These are motor. Done. These two are. These are mixed. Done. So these are motor nerves are which nerves? 3, 4, 6, 11, and 12. Done. After this, some are sensory. Sensory. So sensory which only sensory. Mixed nerves means both. They have sensory and motor supply. So mixed sensory nerves are this is sensory nerve, this is sensory nerve, remaining all are sensory. This is sensory nerve. Done. So we have covered all nerves. So sensory nerve first, second, and eighth. First, second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, 11th, 12th. So these are the 12 nerves categorized. Done. So first we have covered how they originate. So first we done definition of nucleus. What is nucleus? So here it is a collection of neural cell bodies which give rise these cranial nerves, which give rise nerves. Remember, there are two terms. One is nucleus and one is ganglia. So for nucleus, it is important. It is present inside CNS. It is inside CNS, central nervous system. If it is outside, then it is all called ganglia. Same thing, collection of neuron cell bodies. If outside, then it is called ganglia. If it is inside CNS, it is called nucleus. So ganglia. So basically, ganglia किसे बोलेंगे? If it is outside CNS, we call ganglia. Ganglia or ganglion. Done. Singular plural. So these nucleus and these nucleus give rise to the nerves, cranial nerves, and there are many nerves also from the ganglia in our body. These are not present inside CNS. These are present outside the CNS. Basically, abdomen के पास we have learned prevertebral plexus. We have seen there are many ganglia, celiac ganglion, superior hypogastric, inferior hypogastric. These are the ganglions part. So these are present outside CNS and give rise to many nerves. Function, give rise nerves. In nucleus, inside brain, these form the cranial nerves. Cranial nerves. Done. So first, how this nucleus arrange? So next term is functional column. Functional. These are some terminologies. Nucleus and functional column. Next is functional columns. So we write inside brainstem. Remember, these are the functional columns formed by nucleuses or inside brain. These these nucleus which give rise to the cranial nerves are arranged in a fixed pattern, arranged in a particular row-like pattern. So these form a column-like arrangement. So these are called functional column. Let's say they arrange in a row. So this row is called functional column. Some are medially placed, some are laterally placed. Basically simple, it is a line. Arrangement of columns, arrangement of nucleus in a row. Inside brainstem, the arrangement of nucleus in a row is called functional column. Inside brainstem, let's say we can draw brainstem. Let's say these are the some nucleuses. This is the brainstem. Let's say these are the nucleuses. So this is the functional column. This is the one functional column. And how many functional columns we have? 6 functional columns. Basically 6 pairs बोलेंगे. 6 pair of functional columns. And different nucleus arranged in different columns. So this is the column and these are the nucleus. These are nucleuses and this whole is called one functional column. अरे सिंपल रो के एक रो में जो न्यूक्लियस का अरेंजमेंट है उसको हमने फंक्शनल कॉलम बोला है. फंक्शनल कॉलम एक रो में जो न्यूक्लियस का अरेंजमेंट है उसको ग्रुप को बेसिकली. दैट दिस द ब्रेनस्टेम. वी कैन से दिस ब्रेनस्टेम. Then next, how these form. So first, development of CNS is whole done by a neural tube which is present in embryological state. So how these form the functional column. So first, development. We take development of functional column. In embryological development, there is a neural tube in our body which form the complete CNS, brain, spinal cord, brain stem. All these things are formed by a single tube which is called neural tube. Done by a brain neural tube. All these are formed by neural tube. So how this neural tube arrangement look? So we draw. Let's say this is the neural tube. It has some parts. Then this is the tube and it has inside a cavity like this. Then this is the dorsal side, this is the ventral side. Dorsal and ventral. Then this is the inside, and remember, inside neural tube, the lining of this epithelium is called ependymal cells. Ependymal cells epithelium. This is the epidermal cells inside lining of the neural tube. Then you can name it inner lining of neural tube is ependymal cells. Ependymal cells. Then, and this is a sulcus form which is called sulcus limitans. Sulcus limitans. And there are two plates. One is ventral and one is basal. The ventral plate is called LR plate. This is the portion. This hole is called LR plate. This hole is this, and ventral plate is called basal plate, and the dorsal plate is called LR plate. This yellowish part is called basal plate. Then this yellowish. This is called basal plate, anterior to sulcus limitans, and this is called LR plate. And there are we have two types of columns. One are sensory columns, which contain sensory nucleus, basically sensory supply only, and one are for motor supply. So LR columns form the sensory columns, form sensory functional column, functional column, and basal plate form the motor functional columns, basically which contain the motor functional nucleus, form motor functional columns. Done. So next, af- so after this time, this plate, this is the second stage. During development, it breaks from the dorsal side and come out the ventral side. How it look like? Let's say this is the brainstem formation. Brainstem. After during development, these look like this. This is the portion of the brainstem during development. This developed into this. This is the dorsal side. This is the dorsal side. This is the ventral side. And basically, LR plate rotate okay front side में आ गई. This LR plate from the back break and it come into front side. So now this is the sulcus limitans. This is sulcus limitans. Done. This portion are for motor columns and these are for sensory columns, because this is the basal plate and this is the LR plate. Done. So we have 6 columns. Arrangement is similar. We write during development. during development इसमें change होगा. This is the neurative force, and the central cavity is form the fourth ventricle of brain. Fourth ventricle of brain. Then fourth ventricle. Then this is the ventricle. So there are columns. We draw from the superior view, so we only see the nucleus. This is the superior view. So how these columns arrange? Let's say in motor column the arrangement is different, and ventral and sensory column the arrangement is different. So first we draw the motor column arrangement. So in most medially and ventrally is 1, 2, and 3. These are 3 motor columns, and these are 3 the sensory columns for sensory nucleus. Then they have different name. Wait. We can write this is number 1, number 2, number 3. This is number 4, number 5, and number 6. These are 6 functional columns present in brainstem. So their names and their work. So first, since we discuss the motor columns. So now we discuss the first motor columns. These are motor columns, motor columns, and these are sensory columns. Sensory columns. So first motor columns से start करते हैं. Motor columns. So first motor column is general somatic efferent. These are the motor columns. So these supply to the muscles and glands. So these are the efferent columns. We can write efferent. These are efferent, and these are efferent. They take input and they give output. So first is general somatic efferent. Done. General somatic efferent. So it is efferent. So it gives the muscular motor supply of the face. So remember, there are two types of muscles in our face. One which skeletal muscles which develop from the somites, and one which develop from the pharengeal arches. We discuss later. So basically, first we discuss it. There are two types of muscles in our face. types of skeletal muscle. Basically, in our body we know there are only majorly three muscles present. All three muscles present: skeletal, smooth, and cardiac. But in our skull there are two types of skeletal muscle present. Skeletal muscles, two types. One develop the from somites, जो normally और whole body में होता है. This is the normal, and one is different, only present in skull. Develop from pharengeal arches. Pharengeal arches. So, so they have different functional column supply. The somites muscles are include, basically somites muscles में include कर सकते हैं. Extra ocular, basically eye muscles and tongue muscles. Extra ocular, basically eye muscles and tongue muscles. Tongue muscles, and all muscles develop from the pharengeal. Remaining muscles are face muscles, facial muscles, or facial muscle, muscles of palate. Palate, basically the mouth part, mouth roof of mouth. Palate, larynx, pharynx muscles. Then, so they have different supply and they have different supply. So first, for general somatic effect, so it supplies the muscles of the somite. Then give motor supply to somite extraocular, ocular, and tongue muscles. The next motor column is special somatic, special visceral effect. Wrong. Special visceral efferents. Special visceral efferents. In this column, basically it is a misnomer. This column is supply the skeletal muscle which is developed by pharengeal arch, but its names include the visceral. This is not visceral. It is also called branchial efferent. Brachial branchial efferents. Then this is the different name for this. Or it supply the give motor supply, motor supply to pharengeal arch muscles. Pharengeal arch skeletal muscles. नाम में विसरल है बट सप्लाई करता है स्केलेटल मसल को. Skeletal muscles and nerve include are basically nerves include होंगे यहाँ पे. First is fifth nerve, fifth, third. There are three branches of the fifth nerve. The first is fifth nerve. It is called mandibular nerve. Nerve. Next is facial nerve. Seventh nerve. Facial nerve. Ninth, glossopharyngeal. Glossopharyngeal. And the last is vagus. Done. So which nerve supply this part? So facial nerve supply face muscles, face muscles, glossopharyngeal supply the one muscle of the pharynx. It is called stylopharyngeus. 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 And vagus nerve supply. Vagus nerve include muscles of larynx, palate, and pharynx. This mandibular nerve include some tensor muscles, basically palate muscles also. Palate muscles also. Plate nahi palate. Palate muscle. Different palate muscles and we will discuss later. Done. So next column is, so this is the again motor column. So next motor column is general visceral efferent. This is the special visceral efferent. This is the general visceral efferent. So it gives the efferent supply to the glands. Basically, this is for glands. Give secretory supply to glands. Glands, which gland? Parotid gland, submandibular, sublingual, all are. Parotid सब mandibular फेस की ग्लैंड्स है and sublingual include only face glands lingual. Then these are the this is the general visceral efferent supply. So this is the motor columns. Remember, these are the motor columns. All are motor columns. So we can form a column. So these are the motor columns. Then next we will discuss the sensory columns. So sensory columns are like similar. जैसे these are the efferents, so these are the efferent. These are the efferents, so they are the efferents. Then remember, in this, in efferents, there are four columns include. So we can say the seventh column also. Seventh. This is seventh. The name are similar. Just mirror to match this. Remember, this one is the general somatic efferents, special visceral efferent, and general visceral efferent. So this is the whole mirror image. So this fourth column is the general visceral efferent. This is the special visceral efferent. This is the general somatic efferent, and the last is special somatic efferent. We will discuss. Then, so here we discuss from fourth. So fourth column is mirror image 2. General, first is general visceral efferents. Efferents. These are afferents. Sensory है ना? These are afferents. So general visceral efferent मतलब general sensation from the all whole body. General sensation means touch, pressure, pain. All these are the general sensations. Then remember the somatic afferents or efferents are far different. It doesn't mean if these are the afferents, give the motor supply. So these take the sensory supply from the these systems. These take the whole body general supply. These are two different. So first we include here general sensations. Take general sensations. General sensations include touch, pressure, pain, temperature, all. Proprioception also include. These are general sensation basically. Then these general sensation take from the whole body. It समझे? ये बिल्कुल मतलब नहीं है कि अगर जी कि इफरेंट्स इनसे मोटर सप्लाई दे रहे हैं इनको तो एफरेंट उन्हीं को सेंसरी सप्लाई लेंगे उन्हीं से नहीं डिफरेंट आर विसरल आर डिफरेंट एफरेंट मोटर आर डिफरेंट so this is the fourth column. Next is fifth column, mirror image according to this. First is general visceral efferent, so next is special visceral efferent. In visceral organ there is a only special sensation. Which are special sensation in our body? Remember, there are special senses in our body. Special senses include, we can say, special senses. Special senses are आई से देख पाना, seeing objects from eye, smell from nose, hear from ear, and taste from tongue. These are special senses. Done. So only this is the visceral organ. On all not are the this visceral organ. So the sensory special visceral sensation is from only taste. We can say the taste sensation. It include taste sensations. Taste sensations. Done. Next is the next column is sixth column gen, general somatic. This was the efferent. This is efferent. Efferents. So this column take general sensation from the normal body. Sensation from body like proprioceptions, basically near the muscles. These take the sensation from the visceral organs and these take the sensation from the muscles, near muscles. Done. And the last column is special, more laterally, special somatic, this extra column for special senses, efferents. Take efferents from these nerves. Done. Basically, special senses are eye, ear, टंग वाली तो ऊपर चली गई, आई ईयर, तो और क्या क्या बचा हमारे पास, आई ईयर एंड नोज. Sensations. Done. Basically आई ईयर चेक करते हैं. Done. So these sensations. These are special senses for special senses column. Done. So these are the sensory columns work. Done. These are the motor columns and these are the sensory columns. So this is the portion we have discussed. Done. All these things. First we discuss cranial nerves, pair, which are sensory, which are motor, which are mixed, nucleus definition, functional column, development, and now these are the columns, motor columns, and these are the sensory columns. 4 sensory columns and 3 are motor columns. Total 7 columns over here. And these are special senses. Done. So here you can form a box for these. Done. For these sensations. These are sensory and these are motor. So now next we will discuss the which functional column contain which functional nucleus. So where we again form a single table, functional column nucleus. Functional column and nucleus. Which column contain which nucleus? And remember, we have seen only there are 12 nerves in our body, 12 cranial nerves. So it doesn't mean there are 12 nucleus for each nerve. But basically, each nucleus has each nerve. Some nerves don't have nucleus. Some nerves have not nucleus, but some are have. First two nerves don't have nucleus. Remember, these two nerves don't have nucleus. They don't have nucleus. Nucleus for origin. So there are only 10 nucleus present in our body. We can write only 10 nucleus for one for each. initial two nerves don't have nucleus. So we can write here point first and second nerve cranial nerve इंक्लूड कर लेते हैं. Cranial nerve don't have nucleus. So how many nucleus present in our body for cranial nerves? 10 nucleus. Total 10 nucleus for cranial nerves. For cranial nerves. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Done. One nucleus for each nerve. Next. Separated. Done. So the next is we discuss this. So here we know brainstem is formed. There are different levels in brainstem. These nucleus present and form the column. So first is midbrain. Midbrain, pons, and medulla. These are three parts of brainstem. And these are the columns we write. General, somatic, efferent, motor columns पहले लिखेंगे हम. General, wait, generally special. Special, somatic, efferent, and next is general, visceral, efferent. Motor columns. Then next is general, visceral, efferent. Mirror image to this. Special, somatic, efferent, and general, somatic, efferent. General visceral efferent and special visceral efferent we include twice. We include together. General visceral efferent and special visceral efferent. Wait, we write. एक minute. This is visceral. Remember, this is visceral. This is visceral and this is visceral. Because नाम visceral है but supply किसको करता है? Skeletal muscles, pharengeal arches muscle. Then general visceral efferents and special visceral efferents also include here. Special visceral. They are not different. They are together. Then they are not different. They are together. Special, and the last is special somatic efferent. So these are the 6 column, but these are together 7 column. Done. So the nucleus present here. General somatic efferent is supplied which muscles? Basically extraocular and tongue muscles. So extraocular and tongue muscles include nucleuses of different. We draw here. So first nucleus is midbrain at third nerve nucleus and the fourth nerve nucleus. Extraocular and tongue muscles. Done. And here is a big nucleus for hypoglossal. and at pons level the nerve of sixth nerve nucleus. So this is third nerve. This is third nerve. This is fourth nerve nucleus. This is sixth nerve, and this is 12th nerve. 12th nerve nucleus is big. So these are the nucleus in general somatic efferent. Next is special visceral efferents. Done. So here nucleuses include which nerve? Basically pharengeal arches muscles. So here we can include the big nucleus in here for which nerves? Here it contains three nerves. First is ninth nerve, 10th nerve, and 11th nerve. There is no nucleus in midbrain level. The it's next include the third nerve, basically mandibular nerve, fifth nerve की branch है trigeminal. So we can include third nerve, fifth fifth nerve की third branch. Done. And here facial nerve nucleus, seventh. Done. These are the nucleus in special visceral efferents. Next is general visceral efferents. So here we include the glands. So here we have glands nucleus. So first nucleus at this level is Edinger Westphal nucleus. This is called Edinger Westphal nucleus. We discuss it. Next is at these levels. These are some nucleus for glands. And the last is at this level. These have different names. We can write here Edinger Westphal. Edinger Westphal. Done. Nucleus. We discuss it. This is superior salivatory. This is superior salivatory. And this is inferior salivatory. And this is dorsal nucleus of 10th nerve. This is, we can write here, dorsal nucleus of which nerve? 10th nerve. Then these are the three nucleuses. We discuss it. First, here we discuss. There are three nucleus in which column? General visceral efferents. So first nucleus Edinger Westphal nucleus. This whole name is Edinger Westphal nucleus. It is related to the थर्ड नर्व का न्यूक्लियस है बेसिकली थर्ड नर्व के अंदर आ जाता है रिलेटेड टू थर्ड नर्व related third nerve and this directly or indirectly supply the this indirectly supply which nerve which muscles ciliary muscles of eye ciliary muscles remember ciliary muscles including power accommodation we have learned in earlier classes 10th class में आते हैं ciliary muscles power accommodation के होता है next is these are two nucleus one is superior salivatory and inferior salivatory superior salivatory includes seventh nerve this for seventh nerve which nucleus superior salivatory salivatory nucleus this supply the this supply which gland it supply the parotid gland remember it supply the parotid gland wait and this first we nucleus cover कर लेते हैं पहले this is inferior salivatory it is related to the ninth nerve this is inferior salivatory inferior salivatory this is name and this the nerve include then superior salivatory inferior salivatory and the Westphal so it supply the parotid gland indirect way में we discuss the pathway this supply the submandibular mandibular and sublingual gland बेसिकली सलेवरी ग्लैंड की बात कर रहे हैं लिंगुलर नहीं लिंगुअल सबलिंगुअल ग्लैंड्स done and the last is dorsal nucleus of vagus give rise to vagus nerve and supply the many organs whole body basically parasympathetic supply के लिए होता है parasympathetic supply vagus के nerve है ना give rise to vagus nerve vagus nerve is not only formed by this there are three nucleus related to this then so this is the one nucleus so this is the column of general visceral efferent nucleus four nucleus is a different level पे next is we include this column this has only single nucleus this dorsal nucleus is also big remember this is the big nucleus next is there is only nucleus in this column This nucleus is called nucleus tractus solitarius, and this nucleus is called nucleus ambiguous. Ambiguous name है just, and part which it supply. Upper part include special senses, special visceral senses, special visceral senses, efferents, and the lower part include general visceral efferents. Then special visceral efferents basically include taste sensations and general visceral sensation from the normal body. Then, and the last is next column is next is second last. This is also important column. This column is very important. It has a big nucleus starting from the midbrain to the whole brain stem. This is a big nucleus. It starts from this level, done like this. It is a very big nucleus. Then one part, and then it descends like this. It is a fifth nerve nucleus, central trigeminal nucleus. Nerve, fifth nerve nucleus. डिफरेंट पार्ट्स इसका. ऊपर वाले पार्ट को हम बोल देते हैं, ऊपर वाला पार्ट, लोअर पार्ट, different parts. And the last column is, we discuss it first. First we discuss it. Fifth nucleus. It starts from the midbrain and descend to the C2 level even. पूरी ब्रेन स्टेम को पार करके चला गया, ब्रेन स्टेम में चला गया at upper and lower head, midbrain, and this is C2 level. This part is included mesencephalic nucleus. This part is mesencephalic nucleus. This part. This is the central trigeminal nucleus, which gives rise to trigeminal nerve. Central trigeminal nucleus, and this is the spinal nucleus. Spinal nucleus. Nucleus. So first, take the function. It is for proprioception. Proprioception means muscles related information. Proprioception, muscle related. This is for touch, pressure. This is for touch, pressure. And this is for pain and temperature. pain and temperature. Remember one point. The facial nerve and the trigeminal nerve both are mixed nerve, but there is some important point. Trigeminal nerve is mostly sensory nerve, but the facial nerve is mostly the motor nerve. Then this nucleus is fifth nerve nucleus. Nerve nucleus. The important point है trigeminal nerve is mostly sensory and the facial nerve is mostly motor. So they have two components. One is motor and one for sensory. We discussed it. So here we can write important point above. Include include कर लेंगे नीचे include कर लेंगे. So here we can write this. Move. So this is the nucleus, and the next is last is special somatic efferent. So we have six nucleus include. This nucleus present at pontomedullary junction, means pons and medulla के बीच में, like this region include. Here we have six nucleuses present. These are vestibular nucleus and they are two cochlear nucleus. We can write vestibular and these are cochlear nucleus. These are for basically different eye, nose, all these things. So these are the functional column table. Whole functional columns include here. Then these are the functional column and their here we can write these note. Here trigeminal nerve is mostly sensory and facial nerve is mostly motor. नोट करके डाल देते हैं. Fifth nerve. One note is fifth trigeminal nerve is mostly sensory. These both are both nerve. These both are including both mixed nerve, but some have mostly sensory, some have motor component mostly sensory nerve, and seventh facial nerve has mostly is mostly motor nerve. Is आना चाहिए. So these are two notes here. Done. So these are the points we have discussed now till now. Basically the first cranial nerves, which cranial nerve has which cranial nerve is mixed, which cranial nerve is motor and sensory, nucleus, functional columns, development, functional columns role, क्या क्या किसकी sensation है, and the next is sensory columns, special senses, last is functional column table. Then these are functional column, this is functional column table, and some nucleuses. The nucleuses of which column? These are nucleus of which column? general visceral. Basically, this is for gland, na? Mhm. Which nerve? General visceral efferent. Visceral efferent because it is for glands. So it includes glands, parotid glands, submandibular, sublingual, all are. So this is for, and the next is trigeminal nerve nucleus. Done. And last name we have seen 2 points. So next time we discuss the cranial nerves. Thank you.